Nice to meet you, my tiny little angel.
Hope and celebration at this New York hospital. A mom meeting her baby for the first time after giving birth in a coma 16 days ago. Now recovered from the coronavirus, her advice, live life the best you can and find joy in the good things. Good things is what so many Americans are desperate for tonight as the death toll continues to mount. A decade's worth of job gains officially wiped out in a month. 22 million Americans now out of work, including some healthcare workers who claim they were let go for trying to protect themselves. A massive problem at a New Jersey nursing home revealed after a request for dozens of body bags. At least 68 deaths at this one location. The governor says he's outraged and confronting a pandemic, fearful that you don't have access to clean water.
We have to do this in order to survive.
The challenges some communities face tonight to do basic things like wash their hands or shower. And while the president is moving ahead, just releasing new guidelines for how and when communities can get back to work, governors are saying not so fast, pumping the brakes on reopening. Good evening, everyone. I'm Lindsay Davis. Thanks so much for streaming with us. From the lives lost to the jobs lost, COVID-19's contagious spread continues to wreak havoc in the workforce, from retailers to restaurants, all falling victim to the impact of this vicious virus. While much of our attention in recent weeks has been on the people on respirators, tonight we're going to shift slightly to the economy now on life support. Tremendous uncertainty for millions tonight. Just in the last 4 weeks, 22 million people have filed for unemployment. That means 1 out of 7 workers in this country has lost their job in about 1 month's time. Cities across the country are bracing tonight for massive budget shortfalls. In New York City, the mayor says he's making wartime cuts. The government small business fund has now run dry. Thousands of companies remain in limbo, shut out as they wait for a bitterly divided Washington to make a deal. And mounting frustration for so many at home tonight, waiting for stimulus checks in the mail and spending hours on the phone to apply for unemployment. But with several states now extending their stay-at-home orders, our David Wright leads us off with more on the economy on the brink.
There are 2 sets of coronavirus casualties. As of today, 630,000 Americans are confirmed to have been infected. And as of today, another 5.25 million Americans are unemployed.
My name's Todd Sayland. I'm 49, and I'm a server in Fort Lauderdale, Florida.
People like Todd Sayland of Fort Lauderdale and Tina Plastini of Monroe, Connecticut.
I was part of a massive layoff of about 100 employees.
Over the past month, more than 22 million Americans have lost their jobs. That's roughly equal to the total number of jobs created in the decade since the last recession ended. That includes workers from restaurants and retailers, hotels, airports, and offices from coast to coast.
I am a single mother. I have no money, no food, and I am trapped waiting for the Department of Labor to approve my claim.
Tina Plastini applied for unemployment 3 weeks ago. She says she has yet to hear anything back.
I really need to know what's going on. If there's a problem with my application, I wish they would reach out to me. They have my cell phone, they have my email, they have my address, and I have not heard anything from the Department of Labor.
Same for Todd Sayland in Fort Lauderdale.
Our restaurant was shut down on the 17th of March, so we were furloughed on the 17th.
He filed his first jobless claim on March 17th and says he has yet to see a penny.
It's supposed to be available from 7 o'clock on. As you can see, there's no... So I can't file my biweeklies, so my day will consist of jumping on the computer and doing this all day.
I've gotten stuck in automated round and around and around. I can't speak to anyone. And I need some answers. I need to know why there are my previous coworkers have been approved after me, and I have still not been approved.
And what about those $1,200 stimulus checks we keep hearing about? The check's in the mail. The administration says the first wave of 80 million checks went out this week, and direct deposits have already begun.
I'm sure people will be very happy to get a big, fat, beautiful check, and my name is on it.
You know, I was really worried, waiting for the unemployment. But now, that I've received the $1,200 deposit, we're going to be okay.
The stimulus check I have not got, but I have not received it. But I know some of my friends have received their stimulus check. Of course, when that finally hits, that's only $1,200. That here in Lauderdale basically pays rent, but certainly it will help, pay a few bills, reimburse a little bit of savings that I'm bleeding.
But a loophole in the massive bipartisan relief bill has given banks and bill collectors the green light to seize those deposits to cover outstanding debts and bank fees, meaning that some people who are already stretched beyond their means won't get any relief at all. One saving grace should be the $350 billion in loans for small businesses that was part of the stimulus to help businesses fund their payroll through the slowdown.
This action has saved millions of American jobs. It's been an incredible success.
Hello, my name is Marcos Rivera, and I'm the owner of Libertad Restaurant here in Skokie, Illinois. I've been in the restaurant business all my life. I grew up in it.
Rivera is one of thousands of small business owners who've applied for the program.
And I'm hopeful that it works as how it was intended to. Restaurants operate in a very low margin, and it's very difficult going from a sit-down restaurant to a carry-out and delivery restaurant from one day to the next, and much more difficult without some sort of loan to help us weather the storm and get to the other side of this.
The way the program works, the Small Business Administration loans you up to 2.5 times your monthly payroll through private lenders. And that loan is forgiven so long as 75% of the money is used for payroll. That's to encourage businesses like Rivera's Restaurant to keep and rehire their employees.
Once the portals opened up from the banks, the bank servers were overwhelmed, and they went down because of such a high demand. If we can get this program and with some adjustments, it will be a lifesaver for restaurants like mine.
But the website now says the program has officially run out of money. The administration and Congress are in talks to increase the funding, but not quickly enough.
Exhausted is a good thing, not a bad thing. It went quickly. It is so popular. The banks have been incredible, including 4,000 community banks. 4,000. Most people didn't know you had that many banks. 4,000.
Don't need a lot of them.
What they want is people want to keep this going. And we're doing it to keep the small businesses open and to keep the workers paid.
The plight of this damaged economy is plain to see in the long row of cars lining up at this food bank in Texas. Meanwhile, Wisconsin dairy farmers are dumping milk, and large-scale agribusiness is slaughtering millions of pounds of pork and chicken, not even bringing it to market because they say they don't have enough workers to process them. The impact on Main Street stands in sharp contrast to Wall Street. Even now, the Dow Jones continues to trade above 20,000. Meanwhile, the job market is hemorrhaging, with many communities facing a double whammy of illness and unemployment. Overcoming that will likely require a much stronger safety net.
Every individual story is different. Tina finally got her stimulus check, but she's still waiting for unemployment. Todd is still waiting for both, but he has some savings left. There are 22 million of these stories now, and quite possibly there will be millions more, especially if the federal government doesn't shore up that payroll protection program. Many of these people are having trouble navigating the system, and all of them are dealing with lots of uncertainty. Lindsay?
David Wright, thanks so much for your reporting tonight. And those stories that we just heard really give us a personal look at how this crisis is impacting millions of Americans. It's worth repeating, more than 22 million people lost their jobs in the last month. And in those 4 weeks, all the job gains since the Great Recession, they've been completely wiped out. Here to help us make sense of some of this is ABC's new business correspondent, Deirdre Bolton. Deirdre, great to have you and welcome to ABC News.
Thank you very much. Starting in a very auspicious, historic time. And you mentioned those staggering numbers where, to your exact point, in the past 4 weeks, we have lost more jobs than we created in the past decade. And as most economists are telling me, at this point, the virus is the economy. The economy is the virus. So most agree that testing is the most important way to get people back to work, because people have to make this huge psychological shift from this virus could hurt me or someone that I love, to turning that page to being willing to go back in an office, back in a restaurant when they reopen. And then, of course, that confidence is what's going to underpin business leaders in their confidence to invest, to rehire, to put more money in infrastructure, more money into equipment. So it really is a confidence game. And of course, just one big contextual point. Some experts that I've been speaking with say that unemployment could be as high as 13% in our country by June. And when you compare that to February, that 3.5% level, close to a 50-year low, it just shows you this really tremendous arc that we're on right now, Lindsay.
Yeah, 13%. It's hard to really get your mind around that. But as we've been reporting, those $1,200 stimulus checks have started going out to millions of people. You don't need an expert to tell you that that is not going to be enough. So how much more do you think is needed?
Well, at this point, it's about putting out fires. And many people have said, if your house is on fire, you don't worry about the water damage that is going to come after the firefighters are there. You just need to take care of people now. We know that the Treasury Secretary, Steve Mnuchin, has said that this is really akin to a bridge loan meant to just carry people through these 10 weeks of the lockdown, if you like. But if you look at the average rental for a 2-bedroom apartment in the U.S., just average, it is exactly that, $1,200 a month. So when you say there are people who say it's not enough, that is exactly one data point why that is certainly a point worth making. As far as people who we've already reached out to, most people are spending that money right away on food. So no word yet on further stimulus or further, let's say, support. But there are a lot of people saying it's not enough, Lindsay.
This small business loan program designed to keep small businesses afloat during the shutdown, we just heard, ran out of money earlier today. What needs to happen in order to keep these businesses afloat?
I think one thing that's important to change at this point is that the small businesses, for example, mom and pop pizza shops, for example, or florists, or who these loans were meant to help, it's important that those businesses get the money if more is passed in Congress. As you mentioned, that ship has sailed for the first batch, if you like. But one troubling statistic that has come across is that 82% of the small businesses who received part of that funding, there's about 44,000 of them who are worth $1 million or more because of the parameters and some of the tax loopholes. So you have companies or entities such as hedge funds, for example, who were legally able to apply and receive funds. And obviously, Lindsay, that is not at all who it was intended for. Back
Deirdre Bolton, thank you so much. Can't wait to meet you in person.
Thanks.
The other major headline tonight, when can this country reopen, helping to end some of those job losses that we've just been talking about? Well, here's the reality. Across America, infections continue to rise, and New York continues to be on the front lines of this pandemic. Governor Cuomo announced he would extend the shutdown until at least May 15th. This as another 600 New Yorkers died in just the last 24 hours. Today, the Trump administration released their new guidelines to reopen the country, but keeping the nation safe in the process will certainly be tricky. ABC's Whit Johnson has the latest.
Tonight, President Trump unveiling long-awaited guidelines to reopen America, but making it clear the governors will call the shots.
We're opening up our country, and we have to do that. America wants to be open, and Americans want to be open.
The president's guidelines call for a phased approach. States would be able to move to phase 1 after they see a 2-week decline in the number of people with COVID symptoms and in the percentage of people testing positive for the virus. They would also need to implement a robust testing program for healthcare workers, including emergency antibody testing. Once a state can check those boxes, people would still be advised to maintain social distancing and avoid socializing in groups of more than 10. But businesses could look at ways to slowly return to work. If states are able to go 2 weeks without a rebound of COVID cases, they can move to phase 2, where you could see places like restaurants, movie theaters, and bars reopening with social distancing protocols.
One careful step at a time. And some states will be able to open up sooner than others. Some states are not in the kind of trouble that others are in.
The guidelines come as New York, Los Angeles, and Washington, D.C. extend their shutdowns until at least May 15th.
What happens after then, I don't know. No political decisions, no emotional decisions, data and science. We're talking about human lives here.
Here, the numbers are heading in the right direction, but slowly.
The bad news is 2,000 people walked into a hospital yesterday for the first time with the disease. And the worst news is 600 people died yesterday from the disease.
Doctors like Melanie Malloy in a relentless battle for weeks.
I have a great babysitter who helps me a lot, but sometimes it's a little bit hard.
She takes us inside the emergency department at Mount Sinai, Brooklyn.
Most of our beds are taken up by intubated patients, meaning patients who can't breathe on their own and who are on the ventilator.
Dr. Malloy telling me today she's encouraged that fewer patients are coming in, but says one of the most difficult parts of the job, treating her own colleagues who've fallen ill.
So I just needed to get out of the ED for a little bit. Sometimes you just got to step out for a second.
New York banding together with 6 other states to plan for reopening. Out west, California, Oregon, and Washington forging a similar alliance. And now a new coalition of 7 Midwestern states, including Ohio, where Governor Mike DeWine today announced a plan for some businesses to reopen on May 1st.
We must get people back to work.
Governor DeWine brandishing a mask his wife Fran made for him. He was one of the first governors to act on the COVID threat. Tonight, governors and health officials alike agree the key to the future is testing and tracking the contacts of people who are infected to prevent further spread.
I work for Salt Lake County Health Department.
Salt Lake City says its team of 130 tracers has successfully tracked 85% of the cases in the community.
What date did you start to feel like you had some kind of symptoms?
Massachusetts unveiling its own ambitious plans to hire 1,000 people for contact tracing. But some unwilling to wait. Protests erupting from Minnesota to Oklahoma to Michigan in defiance of social distancing guidelines.
The sad irony here is that the protest was that they don't like being in this stay-home order, and they may have just created a need to lengthen it.
And Whit Johnson joins us now with more. Whit, as the White House and the states are navigating now when to reopen, some encouraging new figures from the task force tonight.
Yeah, Lindsay, President Trump said that 30% of the counties in this country have had no new cases in the last 7 days. Last night, the task force pointed out 9 states that have fewer than 1,000 cases. So this is really going to be a state-by-state rollout when it comes to reopening for business. And as President Trump pointed out today, in the end, it will be the governors who call the shots. Lindsay?
All right, Whit Johnson, thanks so much for your reporting, Whit. And let's drill down on this a bit with Terry Moran in Washington. Terry, talk a bit about the change in the president's approach here. A few days ago, he was saying he had total authority on when things would reopen, but now he's saying the governors will call their own shots.
And that's because, Lindsay, he's had to bow to the constitutional reality, the political reality, and the medical reality. He does not have total authority over issues like what shops, businesses, and schools in local regions and states can open. That is in the Constitution, explicitly given to the states in the 10th Amendment. So that's not part of his bailiwick. He is saying he will authorize and give permission to governors not to reopen on his timetables, but basically he is bowing to that reality and allowing them to open up on their best data and on their plans. That said, the governors and President Trump and all world leaders, they're all in the same boat right now. nobody really knows what comes next or how to do it. This virus is still very new in the world. It's still not well understood why it attacks some people the way it does and not others. And so, as Germany's Chancellor Angela Merkel said today, we're all on thin ice. She said, not exuberance, but caution is the way to go forward. That's not in President Trump's DNA. He is trying to cheerlead this economy back, and I think there will be a tension there as states and localities open up gradually.
Yeah, but on thin ice nonetheless. And just how important will widespread testing be to make any of these guidelines work?
Well, it's the ballgame. Testing and tracing contacts is the entire ballgame. And the United States has bungled testing from the get-go. President Trump likes to say we test more people than any place in the world by a numerical factor. That's correct. But Germany has tested twice as many per capita, and that's one of the reasons that they can open up and monitor. There's also the issue, civil liberties issue, of tracing. It has to be done very thoroughly, and there is some talk about apps that you could have on your cell phone in order to tell the public authorities where you've been if you test positive. I don't think Americans are going to go for that, but it does have to be a lot of testing and very thorough tracing of people's contacts if they do test positive. Right now, that will be basically up to investigators that the CDC and state public health authorities will hire. But without the kind of robust testing program that we see in other countries, we're flying blind here.
Terry Moran for us in Washington. Thanks so much, Terry. And now to a gruesome discovery in Andover, New Jersey. Police there found more than a dozen bodies piled up in an overcrowded morgue intended to hold 4 bodies at a nursing home. A total of 66 residents and staff from just that one home have now died. Many were confirmed to have COVID-19. ABC's Stephanie Ramos on what investigators are learning.
Tonight, families outraged after a grim discovery inside this 500-bed nursing home in Andover, the largest in New Jersey. The bodies of 15 residents held in a small morgue meant to hold just 4 people.
They were overcome by bodies, and we needed to be able to help them.
It started with a desperate call over the weekend for 24 body bags, then an anonymous tip to police. The town eventually using this box truck to help retrieve the dead. In all, 66 residents have died at the facility since January. 33 are confirmed to have died from the virus, along with 2 nurses.
I feel like my uncle died, probably gasping for air.
Beth Ganji tells us her 78-year-old uncle Larry, a resident, went to the hospital with a fever, but was sent back to the nursing home. She says the family was told he was okay, but for days could not get an update. 4 days later, Larry died. Beth says a nurse later told her he was found in his bed.
There was nobody there to hold his hand, nobody there to pray for him.
The virus sweeping through nursing homes across the country, killing nearly 4,000 in states that have tracked the death toll. 22 at this nursing home in Joliet, Illinois, where the family of Gerald Francis says they only learned he had the virus after he died.
I don't know how much he suffered. How much did he suffer? I don't even know.
Tonight, the deaths at this New Jersey nursing home are under investigation.
We're going to have to figure out what went on here. Did they take all the steps necessary up front for protective equipment for the staff? Did they make sure they put everyone, segregate out those who were positive?
You know, the not knowing just adding additional pain and heartache. Our thanks to Stephanie for that. When we come back, the healthcare workers who claim they lost their jobs because they tried to protect themselves. Plus, the guidelines are to wash your hands for 20 seconds to try to prevent catching COVID-19. But tonight, we hear from residents in some communities who say they don't have access to clean water. And turns out the rumors are true. The Duke and Duchess are in Los Angeles, how they surprised some local residents. But first, here are some of the trending stories on abcnews.com. Hospital workers are, of course, on the front line soldiers in this war against an invisible enemy. But some say they were sent into battle inadequately armed. And when some tried to bring in additional protection, they say retaliation followed. ABC's Diane Macedo has this report.
In the battle against COVID-19, healthcare workers are on the front lines. They're thanked every day for their service in different ways around the world. But some are now speaking out, saying while they fight to protect the public, they're being punished for trying to protect themselves.
It could be, who knows, the end of my career doing inpatient care, but hopefully not. But I knew that was a super important issue, and I had to speak out.
Dr. Neely Buckaloo says in late March, she traveled from Post Falls, Idaho to fill in at a rehab facility in Boise, where she arrived to work wearing her own N95 mask.
I went through my day, no issues. It came in the next day, and I was sat down by the CEO of that particular hospital, just the rehab hospital, and told that I couldn't wear my mask.
What reason did they give you?
It's against hospital policy to have your own PPE. The reason was, well, if you wear PPE, everyone will want to wear PPE, and we don't have enough. So I wasn't satisfied with any of those answers, especially given the risk that I pose to the patients being a traveler. They told me that I wouldn't be able to return if I insisted on wearing my PPE.
She says she refused to work without her N95 and was terminated. The hospital tells ABC News that Buckaloo refused to follow its policy barring outside masks, that they offered her a simple respiratory mask because the N95 wasn't, quote, medically indicated for her work in a rehab facility that screens out patients with COVID-19 symptoms, and that they have enough PPE for their needs. Buckaloo insists her main concern was protecting the patients. She says she's not clear what this incident means for her career, but she adds that as an independent contractor, she feels she had more freedom to speak out than doctors on staff.
I knew I had the flexibility and the privilege to speak out and say what's right for an important cause, and so that was my reaction. I need to stand my ground. I need to make sure I speak very clearly about this. That was my reaction. I need to be clear and true and speak out and take this risk.
Nurse Dawn Kulak says she had a similar experience at Virtua Voorhees Hospital in New Jersey after she says she returned to work while still recovering from pneumonia.
When I arrived on the unit, I was given a very, very thin white mask that was comparable to tissue paper, in my opinion. I was told that I had to wear the paper mask unless I was going in a COVID positive room.
Instead, Kulak says she put on an N95 mask she'd brought from home and a pair of gloves from the hospital to use at her workstation. She says it wasn't long before a manager approached her telling her she could only wear gloves in patient rooms.
The thing is, when she was asking me to take off my gloves, she was actively wearing gloves walking around the floor. And
So your superior was telling you to take off your gloves while she was wearing gloves herself?
Yeah. Yep. Yes. And then she says, and that N95, you've got to come off. You're to wear the surgical mask we gave you. And I said, I don't understand why. I said, I'm just trying to protect myself. I said, and I'm getting over pneumonia. I mean, that shouldn't even be an issue. But I was told no.
She says she eventually told her supervisor she'd promised her 10-year-old son she would not take her mask off.
My supervisor told me after that statement, if that's the way you feel, I strongly suggest that you rethink your career. Go clock out, leave, go home.
After her story made local news in early April, Kulak says the hospital changed its policy, allowing employees to bring their own masks. But she said it would not meet her request to provide all employees with N95 masks and still would not allow her to wear gloves at her workstation.
I was told that my actions were putting Virtua employees at risk by my behavior. And I had an option to either resign or be terminated.
Ultimately, she was terminated.
Losing my job for standing up for what is right, that should never be a thing. I took an oath for the greater good, and I took an oath to protect my patients. And I don't see what I did wrong.
The hospital tells ABC News it provides N95 masks to staff who treat COVID-19 patients or those awaiting test results and those in high-risk areas like the ICU or ER. It says keeping our frontline healthcare workers safe is always our top priority. But it's not just doctors and nurses who say they're at risk. Illinois hospital security guard Marvell Moody says he was told on March 10th he couldn't wear any kind of mask at work, even after explaining his elderly mother he cares for has preconditions.
I wore the mask to protect myself because the part of the hospital I work at, we're first contact with patients, and we have a lot of patients come in coughing that's sick and ill.
He says he asked why doctors and nurses were allowed masks, but not him.
My supervisor informed me that it causes hysteria in the hospital.
Concerned for his mother, he stayed home unpaid, but says he tried to go back after the hospital changed its policy.
I called to see if, they was going to put me on the schedule, but I never got a call back. You work for a company for 10 years, and for them to, tell you something like this, it's a little frustrating, a little hurt.
Moody is now suing, a lawsuit the hospital says it's reviewing, telling ABC News that it's committed to maintaining the safest environment possible for patients and staff.
Our thanks to Diane for that. And we still have a lot to get to here on ABC News Prime. Since the beginning, COVID-19 has impacted communities in clusters, but the hardest hit locations so far may surprise you. Plus, Navy leadership now considering the fate of that aircraft carrier captain who was removed from his post after defending his sailors. Could he get his job back? But first, our post of the day, comedian Michael Che paying the rent for hundreds living in public housing in New York City as a way to honor his grandmother.
ABC News, straightforward.
Welcome back. Clusters of positive COVID-19 cases where the disease has spread in one particular location have become a growing concern. And the New York Times crunched the numbers to date, and while the figures are constantly changing, here's a look at the largest U.S. coronavirus clusters by the numbers. The largest known cluster in the U.S., at least 733 cases tied to the Smithfield meatpacking plant in Sioux Falls, South Dakota. Now, that single plant processes nearly 5% of the nation's meat with workers in close quarters. The next largest cluster, some 655 service members testing positive aboard the USS Roosevelt, now docked in Guam after its former captain raised alarms about the outbreak aboard the ship. Outbreaks have also hit hard in American jails and prisons. At least 570 positive cases have been reported in the 10 jails of New York City's Department of Corrections. More than 500 inmates and corrections officers have tested positive in Chicago's Cook County Jail. And as we've reported here, the deadliest outbreaks have come in our nation's nursing homes and long-term care facilities. The largest known so far, at least 179 positive cases among staff and residents at that nursing home for military veterans in Holyoke, Massachusetts, where at least 44 of those veterans who tested positive for COVID-19 have tragically died. And when we return, access to clean water is more important now than ever with the importance of hand washing. But tonight, concerns from communities who fear they don't have access to it. And with so many restaurants struggling to stay afloat, how a group of chefs turned a crisis into an opportunity to give back.
So it's just hard to get, any help right now.
Some 80 million Americans expected to receive their stimulus money this week, but some say it's nearly all gone already. This as the Labor Department reports an additional 5.2 million more people filed for unemployment last week, bringing the total number of Americans filing jobless claims in the last month to roughly 22 million.
That's about the size of the population of Florida.
President Trump says he's hopeful some states may be able to reopen before the end of the month.
Not all states are the same. They're very different. Some are having very little problem. Some have done such a good job that they have very little problem, and they're ready to go.
And now the Small Business Administration announcing the Paycheck Protection Program has run out of money. The White House is asking Congress for an additional $250 billion to replenish funds, but Democrats are pushing for more money for hospitals and states.
Today, New York Governor Andrew Cuomo extending the state's stay-at-home order until May 15th, saying he's cautiously optimistic after the hospitalization rate continues to go down.
There's no light switch. It's not all businesses go back tomorrow. It's what businesses, what do they do, what risks do they pose, and what changes can they make in their business to make them more safe.
At sea, there are nearly 50,000 cruise ship crew members stranded in U.S. waters. No ports will let them dock over fears of the novel virus.
As an American citizen, I should have the freedom to go home and spend this quarantine in my own home.
Nursing homes across the U.S. are seeing clusters of coronavirus patients, and many are reporting a high number of deaths. In New Jersey, one nursing home had 17 bodies crowded into a makeshift morgue that was only supposed to hold a few people. The facility, the Andover Subacute and Rehabilitation Center, has had about 68 deaths in recent weeks. The state is now investigating.
Relieved Navy Captain Brett Crozier still waiting to learn his fate. Crozier was relieved of duty after sounding the alarm about coronavirus on board the USS Theodore Roosevelt aircraft carrier. The resulting investigation has concluded, and the Navy's top admiral will decide what's next, including a possible reinstatement. More than 600 sailors have tested positive. One confirmed death, Chief Petty Officer Charles Thacker of Fort Smith, Arkansas. Crozier remains in Guam, where he is recovering from his own infection.
I'm sure many of us are in the same boat of having these extremely dry hands because we wash our hands at this point many times a day. But what if the water coming out of your faucet isn't clean? You can't trust it. Our Alex Perez has more on communities where people are struggling to do basic things that many of us take for granted.
It's what we've heard over and over for weeks now from officials.
Continue to wash your hands.
Clean water to wash your hands, one of the best ways to avoid coronavirus and stop the spread.
30 minutes when it starts settling, you guys are going to see what we have coming out of our faucets.
But for people like Deanna Berry, this is what she sees when she turns on her faucet.
It's been about an hour, but this is that same glass of water that I poured out of this tap.
Berry is not in a third world or underdeveloped country. She's right here in the USA, Denmark, South Carolina.
It's like a war zone, but you have residents who walk around transacting business and conducting their business and doing their day-to-day because the residents have become so numb to crisis.
To get water she feels is safe to use, she and other residents drive 20 miles to Blackville, South Carolina to a place called Healing Springs.
How y'all doing? Most people come here from all over just to be able to get the water because the water tastes so good. But for us here in Denmark, South Carolina, we have to do this in order to survive.
But the COVID-19 pandemic has made an already difficult situation even more challenging. Ramella Duncan used to carpool to Healing Springs with her neighbors, but she can't anymore because of social distancing.
Right now, we're at almost like a standstill because this COVID has us, and we don't have the resources here in Denmark that we need. Our local officials are not reaching out to different government organizations to let them know that we need help here.
The mayor insists that the water is safe for consumption and that the city of Denmark, quote, is in compliance with the primary drinking water standards under the EPA's Safe Drinking Water Act. But government mistrust lingers after officials put halosan, a chemical not approved by the EPA to disinfect drinking water, into the city's system. So Deanna and a small group of volunteers distribute water coolers to residents in Denmark, taking all of the necessary modern-day precautions.
She and I, we are already clean. We are COVID-free, but we brought some Lysol wipes so we can wipe down the boxes.
The city of Detroit has also had long-standing water issues, and some low-income residents didn't have running water before the outbreak, and now they're even more prone to getting sick from the virus.
There is a real problem of how high the rates have gotten. They're just simply unaffordable for people. So they've restricted a lot of their water-related practices, which affect not only their physical health, but also their mental health.
According to the U.S. Water Alliance report, a startling 2 million Americans don't have running water. So Deanna and others like her are stepping up, providing an essential service to people who feel they've been forgotten.
We're not waiting for people. We're not waiting for our elected officials. We're not waiting for agencies to help us with our pandemic that we're dealing with globally, and also with our water crisis locally. We are just determined to show our resilience and how we rise above, and how Americans, rural Americans, are stronger than people think we are.
Alex Perez, ABC News, Chicago.
Such a really important story to tell. Our thanks to Alex for that. And as this crisis evolves, the disparities in this country are becoming even more pronounced, from the lack of access to clean water that we just heard to the disproportionate way that this virus is claiming Black lives. And that's not because of the way that the virus attacks, but because of the circumstances that certain communities have had to endure for generations. Emergency physician Dr. Garth Walker wrote a powerful op-ed in the Chicago Sun-Times titled, "As a doctor, how do I tell a Black family of 5 struck by the virus to social distance in a 2-bedroom apartment?" highlighting some of the hard truths of our society's shortcomings. Dr. Walker, thanks so much for joining us.
Thank you for having me.
So, Doctor, you start your op-ed with a personal anecdote about a friend asking you what he should do about a sick family member. Tell us about that and why you found yourself at a loss.
As an emergency physician, one of the things that we're trained really well to do is to stabilize patients and save lives. But one of the big challenges is to adapt to the true lived experiences of our patients. And when we talk about our community, the African American community in Chicago, there's just huge barriers that they're dealing with. So when a pandemic strikes, it essentially just lifts the curtain and just shows the inequities in our country. So when I have a patient that comes in and they live in a 1-bedroom apartment with 6 people, it's hard to tell them to socially isolate. We have to be pretty creative about how we do that. And when there's no resources to supplement that, it becomes very, very, very challenging.
Just today, the state of Illinois reported 125 coronavirus-related deaths in the last 24 hours alone. That's their highest death toll since this pandemic began. Do you continue to expect that the Black population will die at a higher rate than other races?
I hope not. But honestly, when you look back at the history, this is decades and decades of disinvestment, decades and decades of mistrust between the African American community and the hospital community. And when you tack on the social and economic drivers that have been driven by structural racism, it's hard to think that African Americans are not going to continue to take the burden from this pandemic. And so my hope is that we're able to recognize the role that race has played in this so that we can come to some real solutions.
Well, you mentioned the word hope twice, and many of us know that hope is not a winning strategy. So what do we need to do? What kind of solutions can be implemented at all levels to help curb the loss of Black lives?
Yeah, so it's going to take a lot of empathy. It's going to take a lot of intention. And it's going to be taking a lot of tackling this straight on. We have to be able to mass test our most vulnerable communities. You know, in Chicago, we just ramped up testing to the south side. But we can't just stop there. We have to be able to talk about the social services that our communities need. So for example, that family that I was just discussing, if they have an elderly patient or elderly person in their home, we have to be able to come up with unique solutions to house that person if they are at risk. And we have to be able to ramp up delivery networks to those members. And we have to be able to think strategically what our most vulnerable populations need. And if we're going to make any type of advancement, we have to be able to talk about the role that race has played, because we're all interconnected. We're all crossing each other's lives. Our essential workers are going in and out back into the community. We have to make sure that they have PPE. And the only way we can do this is take a different approach going towards the future.
Dr. Walker, thank you so much, not only for your time tonight, but for your work every night on the front lines and what you're doing for this nation. We appreciate you.
Thank you so much, Lindsay.
And next tonight, how do you feed the children stuck at home who would have normally eaten lunch at school? Our Clayton Sandell files a report on what a group of chefs in Denver decided to do.
The mile-high streets of Denver may look like a ghost town. But where tables now sit empty, a group of dedicated chefs have turned this dining room at Linger Restaurant into a culinary war room.
This is the back kitchen where we do most of our prep.
Here, where they take temperatures before they take any orders, restaurant group Edible Beats is on a mission to feed hungry kids.
So we've been making wraps of turkey and cheese, and today we have pepperoni pizzas for the kids.
In Denver alone, 60,000 kids qualify for free or reduced meals they'd normally eat at school. But with kids stuck at home, the chefs are helping nonprofits and food banks fill the gap, one square meal at a time.
Yeah, trying to make sure that they have some sort of vegetable and healthy protein and healthy snacks.
Despite being forced to lay off 80% of the staff.
Got chocolate milk for you today.
You guys give me the goosebumps. Seriously, I'm just like, oh, we're blessed.
They're still giving away 200 meals every day.
The greatest part of my job is being able to do this, give these meals out to people because they are so appreciative of everything that we are doing for them. I mean, I've had people, cry tears of joy when they get the meals.
It's a super blessing, and we're super grateful, and I can't even imagine, how this restaurant is being so gracious.
Even delivering to hospitals.
Okay, thank you so much.
Thank you, we appreciate it.
All of it for free.
When the shutdown happened, my wife is a school teacher. My kids go to public school. We knew there was a need at the schools for food insecure families.
Why do this? You're not doing it for money, right?
No. It just feels like we have food and we do our best work when we're feeding people.
Janie Pacheco picked up meals for her elementary school boys.
I just hope they stay open for whenever this is all done so we can come and support the restaurant.
The company says as long as kids need food, they're not slowing down.
In the restaurant, we always say, make your last meal your best, and we're going to keep making every meal our best until it's our last meal.
Clayton Sandell, ABC News, Denver.
Our thanks to those chefs and to Clayton. And a passing to note tonight, Brian Dennehy, the Tony Award-winning actor whose career spanned 50 years in movies, TV, and theater. He has died of natural causes, not COVID-related, according to his family. Dennehy's more than 40 movie credits include Rambo, First Blood, Legal Eagles, Cocoon, and Tommy Boy. The burly veteran actor with his gregarious nature and booming voice earned 6 Emmy nominations for various TV roles. He won his first Tony in 1998 playing Willie Loman in Death of a Salesman, and won another in 2003 for Eugene O'Neill's Long Day's Journey into Night. Dennehy is survived by his 5 children. He was 81 years old. And we'll be right back with the good news that we so desperately need. Well, they may not technically be royals anymore, but that's certainly not stopping Prince Harry and Meghan Markle from performing their duties. The former Duke and Duchess of Sussex have been spotted delivering meals to charity recipients in West Hollywood. While living in L.A., the couple has been volunteering with a nonprofit organization called Project Angel Food, delivering meals to people with HIV, AIDS, cancer, and other illnesses. They've also been helping others in the digital space. Yesterday, Harry hosted a Zoom video chat with the parents of vulnerable children as part of his work with Well Child, an organization that supports seriously ill children who are cared for at home. Finally tonight, the stories that caught our eye and tugged at our heartstrings. So many pitching in tonight to help those on the front line in so many different ways.
Hi guys, some good news out of the United States. We're starting to see the curve flatten in some of the hardest hit areas like New York. It's really the first time since the outbreak began. And in parts of Europe, we're seeing lockdowns starting to get loosened. So in Spain and Germany, we're getting a glimpse of what life could look like eventually. First up tonight, we've got a lovely story for you. We often think of refugees as being people who need our help. But what if the coronavirus crisis was a moment to see how they can help us, inspire us during this time of uncertainty? The United Nations Refugee Agency, UNHCR, is launching a coronavirus campaign, but alongside it, they're highlighting individuals who've been through some extraordinary trials in their lives and have a message for us. I spoke to 23-year-old South Sudanese refugee Mary Maker. She has lived in refugee camps most of her life, mostly in Kenya. She made it to the United States in 2019 to study. Her parents died when she was young, but now she's helping people back in that camp get hold of soap and masks and other things they need to protect themselves against coronavirus. And she had an inspiring message to share.
There's something very powerful in someone with your life story, who's been through what you've been through, being able to teach people like me, who've had comparatively very easy lives, about resilience, about entrepreneurship, about creativity.
Ubuntu. It is a word and it is a phrase. It's a South African phrase, which means I am because you are. Like just being there for each other with a little resource that you have. Just try to impact the life of either your neighbor or somebody else. Remember, COVID-19 is hitting every part of the world, meaning your neighbor needs you right now more than anything else. It doesn't matter how little you feel you're doing something.
Can you maybe share a little bit about how you've kept hope?
Me being a child of war and having seen that, you come to realize that some things are beyond our control. But we can still do something. We can still rejuvenate ourselves by helping somebody else. It gives you joy.
You're such a powerfully positive person. It's wonderful. I love having you beamed into my living room at home. It's such a nice, so much good energy.
Remember, refugees still, they have abilities. They have so much. They have talent. And who knows, we will be the solution to rebuilding our country someday. Yeah.
What an absolutely extraordinary young woman. Thank you, Mary, for speaking to us. And we want to introduce you to another amazing person, 99-year-old Army veteran, Captain Tom Moore. This war hero is now helping our modern-day heroes. And it started as a small fundraising effort. He was to walk 100 laps in his garden for his 100th birthday. He was supposed to raise about $1,500, but now it's exploding. Captain Moore has raised more than the equivalent of $14 million for the National Health Service.
When if you look at this, it says virtues favour the brave, and that's what they are. They're brave.
That is some work from home inspiration. Thank you, Captain Moore. And this crisis has made us all a little bit more creative with our daily routines. Check out some of our favourites.
It's heavy.
Ready, set, go.
Do not break. Where do we drink so much? I don't know where these go.
And now to some people who will gladly take being bored at home. Those who've recovered.
system for saving my life.
And our healthcare workers saluting their recovered ones. Finally, we want to leave you with some inspiration. Connie is 106 years old. She had coronavirus. She was discharged from the hospital this week. So on top of surviving both world wars, she can say she survived COVID-19 too. She says she's looking forward to spending more time with her family, and she feels lucky she has survived. That's it from us. Stay safe, everyone, and be good to each other.
106-year-old survivor. And before we go tonight, police in Port Hueneme, California are showing off the haul from their latest bus. Check it out. 4 sets of bed sheets, 27 boxes of tissues, 30 towels, 31 rolls of toilet paper, all recovered by police after they say 3 suspects stole the products from a hotel maid station. A sign of the times and our image of the day. And that is our show for this hour. Be sure to stay tuned to ABC News Live for more context and analysis of the day's top stories. I'm Lindsay Davis. Thanks so much for streaming with us. But before we go, every night, New Yorkers usually clap for health workers. Well, tonight they sang in unison as this city tries to stay strong.
It's up to you.